So an overview of what an inpatient health system pharmacist is that the patients they treat have a lot of variety. Their responsibilities vary from day to day. The location within the hospital is different, and they have a lot of interprofessional communication. The types of patients they treat are but not limited to neonatal care, geriatrics, and intravenous medication therapy. The day-to-day responsibilities are dispensing medication, purchasing decisions, monitoring drug therapy, preparing IV medication, and drug administration. The location within the hospital can be either centralized or decentralized. Centralized meaning it's in one main area of the hospital, and decentralized meaning it can be in different rooms on each floor level within the hospital. The interprofessional communication going on between the inpatient pharmacist, between the sterile compounding supervisor, the inpatient pharmacy manager, the clinical pharmacist team, the staffing pharmacists, technicians, physicians, and nurses. We interviewed Dr. Amy Braden. She's an inpatient health system pharmacist. She completed her residency after graduating University of Charleston Pharmacy School at the University of Louisville Hospital. Midway through her residency year as a clinical float pharmacist, she began this position post-residency, and she practiced clinically for around a year, after which she had the opportunity to join the leadership and management team. She began her position as the inpatient supervisor in April of 2018. She works directly with her counterpart, the sterile compounding supervisor, her inpatient pharmacy manager, and she focuses heavily on operations of the inpatient pharmacy, but serves as a subject matter expert and manages essentially all aspects of dispensing, staffing, and inventory. We asked her why she chose inpatient health system pharmacy. She said during pharmacy school, she completed a pharmacy internship at a local community hospital. Before that, though, she had worked in an independent pharmacy, which originally influenced her career choice altogether. As much as she did enjoy the independent side of retail, she found it to be very mentally exhausting, and she also saw the job market to be unsustainable. She has always been more interested and passionate about clinical patient care, and she loves a variety of hospital pharmacy and the ability to practice at the top of her pharmacist license. We also asked what aspects of the job are most appealing to her. She likes that it allows her to be involved in all aspects of what it means to be an inpatient pharmacist. She's able to work closely with her clinical pharmacist team, her staffing pharmacist, and her technicians. She also loves that she gets the chance to work as a staff pharmacist on a regular basis so that she can directly be involved in the workflow that she is responsible for managing. We also asked her what aspects of her job are least appealing. To her, it's because she's responsible for scheduling all technicians within her department, that being both sterile compounding and other technicians, and that encompasses around 50 individuals. It is an extreme challenge to ensure that they're fully staffed, and she doesn't like that she has to deal with human resource issues, meaning hiring, firing, attendance write-ups, progressive discipline. And before she took this position, she had no HR experience and have essentially learned as she has gone along with being in charge. And she said it was also difficult dealing with employee situations, but yet it's rewarding when you see struggling employees succeed. And we asked her what advice she would give students who are considering selecting inpatient health system pharmacy as a career choice. And she said we need to take into consideration that it is a lot of responsibility when taking on this career. It has intense job requirements that comes with it, and we really have to be open-minded and being flexible. And the key to this job is being able to communicate well with others, because there's a lot of interprofessional communication going on. We asked her what her day-to-day life is as an inpatient health system pharmacist. An overview was that it was unpredictable. She had minimal structure, and she had a lot of meetings. Dr. Amy Braden gave us a breakdown of an example of a day in her life as an inpatient health system pharmacist. She said literally anything you could think of that would go on in an inpatient pharmacy. Her days are often unpredictable with minimal structure. She often has meetings to attend, but what I do in between those really depends on the highest acuity issue that has been identified. For instance, the day that we interviewed her, she had a call out for a pharmacist, so she had to fill in as a staff pharmacist for 2 hours until she could rotate coverage. She then went to one of the nursing units to change a cartridge on a narcotic disposal receptacle. She also went to a new ICU unit of their hospital to meet with the nursing manager to discuss medication storage and organization of patient-specific bins within the medication room. After those activities, she had a 3-hour workflow meeting with various vendor representatives and other members of their hospital leadership team to discuss implementation of Omnicell hospital-wide. After that, she met with the same group in the afternoon and then assisted her technicians in filling cart fill. Before leaving for the night, she worked on the technician schedule for the next day, and she answered a few emails that she had missed throughout the day. We asked her if she was specialized or needed to be specialized for this career. She answered that she does not have a specialty. However, she's more of a generalist. Before she took her current supervisor role, she was a clinical flow pharmacist, meaning that she was trained to be able to fill in for any clinical pharmacist except for oncology, although she is trained to some degree in oncology. Her favorite areas to practice are critical care, meaning the ICU, and the emergency department. We asked her if she interacted with other healthcare professionals daily. Her response was constantly. She sits on many interdisciplinary committees. She also speaks with nursing staff countless times per day. Working in an academic medical center, she also has the opportunity to interact with medical students, residents, nurse practitioners, fellows, and attending physicians several times per week, if not daily, depending on what role she's filling in for that day. Additionally, she serves as an active preceptor for her pharmacy residency program, and she also coordinates their IPI institutional rotation with 2 pharmacy schools. And she also communicates with all the other types of pharmacists that we said in the beginning, her sterile compounding pharmacist, her staff pharmacist, her clinical pharmacist team, just anybody that she can encounter on a day-to-day basis. So after interviewing with Dr. Amy Braden and learning what an inpatient health system pharmacist is, we reflected that we learned that you have to work closely with other professionals in various departments, and it is key that you have good communication skills because you have to have knowledge of what all the other departments entail. We learned that she has a lot of administrative duties, and we were not aware of that before. But the upside to all of these responsibilities and the major job requirements is that you never get stuck in a routine because your day-to-day can vary vigorously.